Hello, I am Umayal Subramaniam and I'm founder of Squirrels Play School in Tanjavur, and I am a core member of the Spectrum, the Awareness Project team. Today, I welcome you all to Talk to the Expert series 149, where we'll be discussing early intervention and rehabilitation programs for children with on the spectrum. The theme of this year is coming together, and November is for advocacy of neurodivergent individuals. So our guest today is Ms. Madhavi Adimulam, founder of Ananya Child Development and Early Intervention Center. Madhavi is also a parent of 26-year-old Varun on the spectrum. She is a visionary and a leader in the field of pediatric rehabilitation and early intervention. She founded Ananya Child and Early Intervention Clinic in 2007, and she has been pioneer in forming Autism Society of AP and Telangana in the years 2000 and 2014 respectively. She holds master's degree in psychology, special education from Osmania University, and advanced studies in entrepreneurship from ISB. She is a Hanan certified parent coach, auditor integration therapist. She is committed to inclusivity and advocacy and creates teacher training manuals to include children with autism into mainstream schools, and also works for rights of people with disability in the states of Telangana and Andhra Pradesh. She contributes to create an inclusive and progressive learning environment for children and families of children with special needs across India. So joining us also is Deepika from Association of Sign Language Interpreters, an official partner to make the session accessible for everyone. Welcome, Madhavi ma'am.
Thank you so much, Umayal. It's an honor to be part of the initiative that you guys are running. I'll do my best. Let's start the session.
So tell us about your journey. How, as a parent of Varun, you found out that he needs intervention, even when the doctors were not aware of it.
So, see, this was about when Varun was 2 years old. That is when in about 2000 or so, I could see that Varun's, towards the end of 2000, I could see that Varun's development was not happening the way it's supposed to happen, because when I used to see other kids and Varun, I easily could understand, that his development is not going in the right track. So I used to go to the doctor, my pediatrician. She's a wonderful pediatrician. I used to go to her and ask her about, is there anything wrong with Varun? Why is he not behaving like other kids? She would say, let's wait for some more time, because those days the episodes of autism cases in the clinics were very, very less. I don't think she saw many cases of autism in her clinic. So probably we were one of the first few cases that she must have seen. And that's why she told us to wait and watch. But I knew that waiting probably is not a good idea. So I myself went to another clinical psychologist in Hyderabad, got Varun assessed. And she told me that the clinical psychologist told me that Varun has autism and he needs help. Okay. So I think I had to do that on my own. And meanwhile, I was also doing little research on the internet, and I found there was no Google that time. So it was very difficult to do research. There was something called Ask Jeeves, and I went on that and I found out from Autism Society of America website, there was a parent questionnaire that I had answered, which said that Varun kind of ticked off every single box in that questionnaire. So that's when I was introduced to the word autism. And then the psychologist also confirmed the diagnosis of autism. That's how my journey with autism started.
So diagnosis is not labeling. So how important is diagnosis and how important is early intervention? If there is a diagnosis, how early intervention can be made? So what are the advantages of having an early intervention in such cases?
So let's talk about diagnosis first. When we diagnose somebody with any condition, not just neurological issues, but even physical condition, I think like if you go to a doctor with a stomach ache, if the doctor cannot pinpoint or cannot put you in that category, he won't be able to target the treatment to cure the condition. My stomach ache could be just an upset stomach. It could be, acidity. It could be cancer. It could be ulcer in my stomach. There could be 100 reasons why a person gets stomach ache. Okay. If my doctor cannot, diagnose me properly, he won't be able to direct the medication to treat the condition. For me, diagnosis is just for doctors, it's not for parents. Okay, it's for the doctors, or it's for the professionals to target the treatment to help the condition rather than labeling. Yes, it's a name, it's just a name, and it can change, you know. So it is not fixed. Luckily in India, diagnosis is not some kind of a database where it is maintained for the whole life of the child. In America or in other countries where diagnosis actually enables people get insurance, access to insurance. Whereas in India, that's not the case. There is no such database where the names of kids are permanently maintained, tagged to the diagnosis. So I suggest parents don't need to worry about those names. Those will help us target therapies to help children improve as fast as possible. For instance, if I treat autism like speech delay, the way I do therapy for autism is completely different from the way I would do therapy for just developmental speech delay. Okay, because the whole understanding of the condition is different. Okay, but if I know that the child has autism, then I would address and target the treatment completely differently without wasting a single day for the child. For me, diagnosis becomes an important part of therapy journey to help the therapist target therapies in a very good in a very uh, like with laser focus, I would say. So that's why for me diagnosis is important. As a mother also, I would rather diagnose than not diagnose. Yeah.
So you were saying in US they were maintaining the children's diagnosis for
Yeah.
life and all.
Yeah.
So you have lived in the UK also. You have lived in India also. So
Yeah.
how different it is? How much is the difference, and how differently the children, neurodivergent children, are treated in the UK and in India?
I think it's just a matter of having awareness. I think in India, we are getting there. The awareness has significantly improved over the last 20 years. Whoever I talk to nowadays, and if I mention autism, ADHD, developmental delay, they immediately understand. But 20 years ago, they wouldn't understand. They would ask, what is this autism? What happens if a child has autism? Things like that. In the UK, 20 years ago, the awareness was very, very high. It is more than what it is now in India. So it was very easy for me to go to a school and say, I have a child with autism. I want to get this child admitted in the school. The principal did not even blink her eye. She exactly knew, yeah, what is the condition and how to help the child. And the school did not say this is a regular school. We don't take children with autism. All those discussions did not happen. She just told me that, okay, there is a process for a child who has special needs. I'm going to follow the process. According to the process, I need to immediately hire a shadow teacher or a learning support assistant, it is called in the UK. And the moment we hire a learning support assistant, Varun can start the school. And then he will get into the system. There is a social worker that will be assigned to your family. And then they will start telling you what you need to do, because the Indian diagnosis can get you started, but it won't be able to continue in the system. For you to be part of the UK education system and therapy system, you need to have a UK diagnosis by a UK doctor or a professional. So she said the social worker is going to guide me through this process of getting into the UK system. So they actually had a very clear laid out process, which made me very comfortable to, I know step 1, step 2, step 3, step 4, which we are still struggling to have in India. We don't know what we should do after the diagnosis, because not the government services are not so great yet in our country. Everything is done privately or by NGOs. So there's a lot of trust issues, I feel, still, because when I tell somebody that their child has autism, there is a very high chance that they don't trust me because we are a private organization. They might think that I'm doing it because I want to get their child admitted here for therapy. That's the first thing that will cross their mind. Like private hospitals, when a doctor advises surgery, it is like we don't know if that. Then we go for a second opinion to see if there is a need for surgery actually, or it's just a gimmick for taking some money out of this patient, that kind of a thing. So those are the differences I found in India versus US or UK.
Coming back, you moved to India after a while, and you started your own venture, Ananya. So to help neuro nurture kids in the center, that's the term Ananya uses.
Yeah,
So
yeah, yes.
tell us about Ananya, what you do there.
So what we do is we actually I have my own over the last 20 years, and by working with Varun, I kind of developed my own way of doing early intervention. Okay. I would like to look at the child holistically. I don't believe in fixing the child in 6 months. I will make your child autism free. That's not what we want to aim at. We know that autism is here. If it is autism, it is here to stay, and it's probably going to be a lifelong condition, and the child might need some degree of support uh, throughout their life. Okay. And for my first step will be to work with parents in making them understand that don't go after quick fixes. There are no shortcuts to this. The best thing is to empower yourself, learn about your child's condition, learn to support your child at home and in the community outside home, and take your child out. Let people see your child, let people ask you questions. Why is your child like this? What is happening to him? What is the name of the condition? Talk about it, spread awareness so that the community can include your child. Plus, along with that, come to places like Ananya, where you can get occupational therapy, speech therapy, behavior therapy, whatever therapies the child needs, and work hand in hand. It's a partnership. You're not outsourcing therapy to the center, you're partnering with the center to work with the child. It's a collaboration between the therapy center and the parent and the school, if the school is involved, if the child is already going to the school. So it's like a triangle of these three stakeholders working to help the child, with the child in the center. Okay. And I also involve I mean, medical professionals like neurologists if required. There could be some children with seizures, and we might include psychiatrists at very rarely, but we do sometimes. And we also include nutritionists and pediatricians. So it becomes a very holistic approach. So we have physiotherapy, occupational therapy, sensory integration, speech and language therapy, nutrition, psychiatry, neurology, and pediatrics. I think 7 to 8 different professionals have to work together to make uh, the child a very contributing, and to make the child realize his or her full potential. One person cannot, there is no one person fixing all the challenges that the parents are facing, you know. So that's our approach in Ananya. We want to look at it as a holistic thing rather than only speech therapy. My child is not speaking, so you do only speech therapy. That is not going to get the child anywhere. That won't give you results. A lot of young parents don't understand. They say, ma'am, he's just not speaking, so only do speech therapy. It doesn't work like that, you know? Yeah.
So what are the home programs you offer
So
in Ananya?
nowadays, after COVID, a lot of parents have started reaching out to us online. Okay. And within India and outside India. So we have developed a weekly Monday program for parents where they come online like this Zoom or on Google Meet. We meet them online. We talk to them. We make a program. First, initially, we start with a consultation and an assessment. Then once we know what the child needs, we meet the parents weekly once, and we teach them what activities that they need to do for the child for that 1 week. And we send them all the activities in the form of PDFs to them, and some videos also if required, so that the mother or father can watch and do the activities with the child for the next 5 days. And again, the following week, the same day, the parent will come back and meet us. Before they meet us, they will share the videos of the activities they have done with the child. We would have gone through all the videos and we are ready to give feedback about the videos. Plus, we will make the next set of activities and send it to them. So it's an ongoing process. The idea is we call this neuro nurture. And because I think only the doing activities at the therapy center uh, sometimes is not feasible for various reasons for families. Even within Hyderabad, it's not possible for them to come. If they're outside Hyderabad in a remote place, definitely not possible for them to come. Especially now, parents are reaching out to us from Canada, America, Ireland, Australia, like literally every part of the world. People are reaching out to us. Indian families find it culturally very difficult to make the Westerners understand our home setups. They don't understand how Indian way, what is the Indian way of bringing up children. When an Indian mom speak to another Indian therapist, it's very easy to, but we just get it. But if it's a Western therapist, they are not able to understand why are you doing this. Sometimes it can even be misunderstood and misinterpreted by them. So they find it very comfortable working with us online, and it's working. I was unsure whether it's going to work, but it's working beautifully for families, and they are very happy learning all the methods from us, just coming online for one session, and the rest of the 5 days they're working with the child on their own. So we are training the parents to become therapists, so to say. Yeah.
So as you were talking, I had this question. How do you know when it is the right time to put the child into the mainstream schools, to integrate them into schools, or to continue with the therapy?
I think response to name call will be nice, because
Mm.
when the teacher calls, the child will be able to at least turn and look at the teacher. And even if the child can develop 5 minutes of sitting tolerance and be part of a circle time or something, uh, and also, if the child is not, I wouldn't bother much about readiness. I would start sending the child to school anyway and see how the child is in the school and work with the therapist and collaborate with the class teacher and start, you know, wherever the child is, I would start there, and then build on it. I don't think there is a good time. They can start any time, provided the school is willing to support the parent and the child. Otherwise, it's going to be very difficult for the mother to make the teacher happy, because the child is all the time moving, hyperactive, inattentive, the teacher is going to constantly call the mom and say, your child is not doing this, your child is not doing this. Then the mother is going to have a difficult time. So, if the school is cooperative and if there is a helper or a learning support assistant in the classroom or a shadow teacher, it becomes a lot easier. But if the school is not willing to support, no matter what level is the child at, they can make the life miserable for the parents. So it's all about the school's willingness to include the child in the classroom, and the parents' willingness to extend that extra helping hand to support the teacher, and the collaboration that they can do with us so that we can educate the teacher and train the teacher to include. I wouldn't. I'm never. No, I've never thought second time sending Varun to school. He just learned in a few months to do activities, but initially it was hard for all of us to make him sit and make him do simple. But eventually he understood. It took some time, but he got there.
So we now have a question from the audience. Uh,
Yeah.
there, there are not a lot of qualified people. I mean, unqualified people practicing as therapists and charging a bomb. How do I know who is the right therapist for my child?
I'll tell you one thing. It might just completely sound abnormal to all of you, but some of the best therapists were not qualified who worked with Varun. For me, the biggest qualification for any therapist is the willingness to work with your child. Your child should love working with the therapist. And of course, there has to be basic qualification. I'm not saying there is, but more than the RCI numbers and the so many degrees that they have, if they are good human beings, if they are patient with children, if they are loving what they are doing, that is loud and clear. I'll tell you. Can I have like take a minute and tell you a small incident that has happened? We
Yes,
had
yes,
a dog,
please.
we had a dog 20 years ago, 22 years ago, a street dog which we had adopted, and we used to go to a vet. And the vet's clinic had this assistant. Her name was Vijaya, and she was amazing with dogs. Okay, she would just tame any dog, and she would just do any treatment. More than the vet, she was very good with the dogs. Okay, so one day when I went, Vijaya was very upset, and I asked her what happened. Vijaya, are you all right? She said, "No, ma'am. Sir is moving to America to her daughter, to his daughter. He's closing down the clinic. I lost my job. I only passed ninth class. I didn't even finish 10th. I've been working with sir for 15 years. And now I don't know who's going to give me a job." She was a single parent. She was a divorcee with a 10-year-old son. So I said, Vijay, I loved Vijaya. She knew exactly how to work with uh, uh, animals who can't speak and convey their pain. I could immediately relate and said she can be a good therapist because none of her kids speak, and she can actually work with children because she just gets them. So I said, Vijay, why don't you come and work with Ananya for 1 month and see how it is? She just came and she just understood kids. And my son Varun was about 10 years old, maybe that time, or maybe slightly younger. I don't know, maybe 8 years or 9 years old. And he just loved Vijaya. I'm telling you, till now, I haven't found a better therapist than Vijaya in spite of all the RCI qualifications. So, RCI qualification is just a qualification. If the therapist is not willing to do the job, no qualification, no RCI number can help you. So, look for a human who is really friendly with your child, who you like, and who you can actually trust your child with. The rest all can be taken care of, I feel. The basic qualification, even a degree holder can do a wonderful job because our children don't need so many degrees, PhDs, and all those things. Our children need somebody who loves them, who respects them, who understands them. That is the primary qualification for me. Everything else is trainable. Everything else. As a mom, I have taught many therapists who never were, and they became qualified after they came to me. They love the profession and this, how do I actually become a therapist now? Then I said, do this, do this, do this. And over the next few years, they got themselves qualifications. I think I'm looking for people like that in Ananya more than degrees can be easily. They have a degree or a
You're looking
master.
out for people with kindness and compassion.
Compassion and willingness to make a difference in children's lives. RCI number is not going to get you that. That's
So
not possible.
generally, we asked you this question to keep a safeguard against the fake practitioners. So
Yeah.
it
Fake
was,
practitioners, you can always ask them what is your qualification and you can
mm,
find out. And if you like them, you can tell them that, that, okay, then why did you put that? You can challenge them. I'm not promoting fake practitioners, but I'm telling there are more important qualities than just degrees and RCA numbers that we are always worried about nowadays. Yeah.
yeah. Even, even though kindness and compassion is required, the importance of right education and training also cannot be
Absolutely,
ignored.
absolutely. I tell you, what I'm trying to say is, like, for instance, I work with a lot of colleges here in Hyderabad, and a lot of BA and MA psychology students come to me. Okay, they're in final year, final semester, and when I see them working with children, I know that this person has it in her. Then I call them and tell them, like, look, you have that qualities of a therapist. Now just do another this diploma or this course which gets you the RCI number so that you can join an organization in Ananya and make a difference in children's lives. That's what I mean. So their basic qualification needs to be there. RCI with RCI or without RCI, the basic like psychology, speech therapy, those qualifications are required, plus the other qualities of being a nice human being. That is a must. There is no compromise for that.
We
Yes.
understand you very well. And Nina is watching and she says she loves your concept of training the parents as therapists.
Yes,
Thank you,
parents
Nina.
are therapists. Yeah. I'm a parent. I ended up becoming a therapist. And now I train therapists to do therapy. And I'm probably the least qualified person in the building. I have an RCI number, but I have many therapists who have many more qualifications than I am. But they come to me and say, ma'am, I don't know how to do this. Because I live with a person with autism for the last 26 years. What Varun has taught me in 26 years, no course has taught me till today. No training has taught me till today. Yeah.
So our final question for the day: what can we do to make the community more inclusive?
Take your children out, showcase them, flaunt them, take them everywhere. If they're running around in the park, don't feel embarrassed. If they're all over the place in the supermarket, don't feel ashamed that, oh my God, my child is hyperactive. He's touching this, he's touching that. Let him do whatever he does. Let people look at him. Let people ask you questions and be proud and go and tell them that my son has autism. So can you please be more patient with him? He can't stand in the line. Can I cut the line and go to the front and pay the bill? Don't be ashamed. Don't force children to do things that they cannot do with their special needs. I think I have learned to become very thick skinned, you know, and I'm all the time trying to spread awareness about autism. If Varun is rocking in the airport like this, Varun is extremely high functioning, but when he's stressed out or when he's too excited, he just does, even while standing, he just does this. And sometimes I get these weird looks from people who are in the queue with me. I tell them, "Oh, he's rocking. He's rocking his body. It's helps him calm down, and he has autism." I just educate the people in the queue rather than telling Varun to stop rocking, because Varun needs to rock to self-regulate. I don't know. I don't care about what the person thinks about him. I want him to be self-regulated on the flight, right? So I tell people that it's okay. It's fine. He's fine. Things like that. I think the more we hide our children, the more we try to say he's absolutely okay. It is only speech delay. It is not autism. If we are lying to them and telling them that it is only ADHD, it's not autism, then we are doing injustice to our children. We are ashamed of them. We are not willing to propagate the awareness. We are not willing to, flaunt them, be proud of them. They can sense it. If they sense it, it's not nice. I don't want any child to feel that my mother is ashamed of me, my father is ashamed of me. I'm proud of both my sons, and both are unique individuals. Just because one has autism doesn't make him less desirable at all. That's what we need to do. Be proud of our children, showcase them everywhere.
That was great insight. And we have one more question from the audience: how to be a part of Ananya? If someone wants to join the team online, what should they do
You mean for working, or how
for
does
working? Uh,
online? We have a link on, you can send your resume to us. We have a link where you can upload your resume. Then we will receive your resume.
so thank you so much, Madhavi ma'am, for coming today to our platform and talking about your child, your Ananya, your brainchild. And we would like to inform our viewers that this is not only once. We are going to talk to Madhavi ma'am in a few more sessions. And Madhavi ma'am has been very instrumental in doing this thing, including children with autism in primary classrooms. And we'll be discussing about this in one of the upcoming sessions. And we'll be doing sessions with her in regional languages also.
Sure. Thank you.
And to our viewers, we do have the ABCD of inclusion flashcards. So this is available on our Facebook page, and you can go and comment. It has 26 cards that says what you should do. It is a great resource for storytellers. It's a great resource for educationists and parent advocates. And thank you so much, Deepika, for doing the sign language interpretation for this session. And thank you to all our viewers. We'll meet you in the next session. Thank you.
Thank you, guys. Thank you so much.